Hi, my name is Brooke Knowles. Today is May 14th, 2020. Here's my talking points. The bodily system that I enjoyed learning about the most was the skeletal system. The medical professions that treat the skeletal system, you have rheumatologists that diagnose and treat disorders like fibromyalgia, arthritis, osteoporosis. Podiatrists diagnose and treat disorders of the lower extremity below the knee. Chiropractors, they mainly do adjustments of the spine, but they also can adjust joints all over the body. You have physical and occupational therapy that do rehabilitation after, say, a bone fracture or a surgical repair, such as joint replacements. And then the surgeon who would do the surgical repairs of the skeletal system is called an orthopedic surgeon. So the structure that I chose to talk about is the femur. It is located inferiorly to the hip bone and superior to the foot, the ankle, the tibia, and the fibula. Proximally, it articulates with the acetabulum of the hip bone, and distally, it articulates with the tibia and the patella. It can be seen from the anterior and the posterior viewpoints. There are the 5 important landmarks on the femur itself. You have the head, which sits in the acetabulum and connects the femur with the hips. The greater and lesser trochanters are attachment points for tendons. On the posterior side, you have the linea aspera, which is a rough ridge that runs all the way down the center on the posterior side, which is attachment points for hip adductor muscles. Then you have the medial and lateral condyles that come around and they form a smooth place for the patella to glide over, the kneecap to glide over. All right, and then the main function of the femur is to support the body weight, so weight bearing. But then also the anatomical structures of the bone itself allow for movement, walking, running, other complex movements like that.